Hi guys. Hello. Welcome back. My name is Dr. Larissa Assam, and I am a board certified family medicine physician by God's grace. I am also the founder of a platform called ROFI, which is educating women on health, how they can prevent complications in pregnancy, complications in the postpartum period, and just how they can take care of their health in every sense of the word. Okay, so I come on and I talk about different health topics. Today we are going to actually be talking about postpartum hemorrhage. If you've heard about it, great, join the chat, comment below. Let me know what you know about it. If you have a question, feel free to ask your question in the chat. But I trust that this will be helpful. I trust that this will be educational. And please send this to at least 5 women who you know. The goal is to really spread awareness. This is actually one of the things that causes a lot of women to die, unfortunately, during pregnancy and also postpartum. And we don't want that. So please share this with at least 10 women. Okay. Without further ado, let's get into it. So here are some key facts that I want every woman to know about postpartum hemorrhage. Let's start with what the prevalence is. What is prevalence? Prevalence is how common something is in a certain population. Before I go any further, let me pause and give my disclaimer. So, none of the information I'm sharing today is medical advice. Everything is for educational purposes only. All right? Please, the purpose of this is to teach you more about your health. But if you're going to make any decisions, please always make sure that you speak with your designated physician. Okay? So, let's get started. So postpartum hemorrhage is actually one of the leading causes of maternal deaths around the world, okay? We know that 80% of women who die during childbirth die due to reasons which are actually preventable. That is 4 out of 5 women dying during childbirth around the world due to reasons which are actually preventable. And one of the leading causes is this topic we are discussing today, which is postpartum hemorrhage. Okay. In the US, not only is it one of the leading causes of death worldwide, in the US, it occurs in about 3 to 5% of births, okay? So 3 to 5% of births. If you think about it, it may sound like, well, that's not too high. But when you think of how many women that actually amounts to per year, the number is actually very high. So what exactly is postpartum hemorrhage, right? What is this scientific phrase really telling us? It refers to excessive bleeding, okay, that happens after childbirth. So normally when a baby is born, we expect that women will bleed a little bit. Why? The placenta is an organ, and the baby has been living in the placenta for some time. Right? So in the course of the baby being delivered, the placenta being delivered, all the changes that are happening during that birthing process, there is some blood that is to be expected. There are capillaries, there are arteries, there are blood vessels, there are veins, right? All 3 types of blood vessels are there. And so that's where the blood loss is coming from, because blood has been supplying this organ and now the organ is coming out. The baby is coming out and the placenta is also coming out. So we expect that there will be some degree of blood loss. The problem is when this blood loss becomes excessive. When it becomes excessive. So what is the metric, right? There's no perfect science, so to speak, but there is a ballpark number that we use in medicine. And so every single time we deliver a baby, one of the first questions you're going to be asked as the person who delivered the baby is, how much blood was lost. And we call it the estimated blood loss, because it's not a perfect number, right? But you can estimate, okay, I think it was about 100 cc's of blood or 100 milliliters of blood, depending on where in the world you are, right? The lower, the better. The higher, the more concerning. So if a woman loses 1,000 cc's or 1,000 milliliters or a liter of blood in that process of childbirth or more, that is what we call excessive bleeding. And I'm actually going to share a story with you because, yeah, I've had experience with this. And I think it's good to share these stories so that you guys don't think that I'm just speaking from the sky, but real life stories that have happened. So, over a liter of blood in the process of childbirth, now within the first 24 hours. So it matters what's lost immediately after the baby is born, but not only there. This is why it's important that after the baby is born, the woman is monitored very closely. Those first 24 hours, that's usually the time period wherein we would expect to see the most blood loss, okay? So you're not only looking at it at that very moment at that time point of birth, but also for the 24-hour period that will follow. Now, it's possible that there can also be bleeding that happens beyond 24 hours, okay? And I've had cases like this happen, okay, when I was in training, not personally, not in my private practice, by the grace of God. But when I was in training, we would actually have cases. So, okay, before I get into stories. So, 1 liter of blood within 24 hours of childbirth, or excessive bleeding, again, over a liter, right? Happening with now signs of what we call hemodynamic instability. What does that mean? That means that the blood pressure is maybe elevated or it's very low, meaning the woman is bleeding out so much that her body is going into what we call shock, hemodynamic shock. It's possible that the heart rate is elevated, she's struggling to breathe. When the vital signs start to get out of norm, then that's what we call hemodynamic instability. And that's a red flag because it means that she's bleeding out so much that we could lose her. And we don't want that. Okay? The placenta is what we call highly vascularized. Think about it. Literally, life is growing there for 9 to 10 months, right? And so you need blood throughout that time. And then you have this instant and it's like, okay, time for the baby to come out. And now all of that blood flow to the placenta now has to stop immediately, right? Because any excessive amount of flow will potentially compromise the health of the mother. So this is why it's very important that women are monitored immediately after they give birth. And we're looking for clots, we're looking for excessive bleeding. All of it is put together to say like, okay, how much blood are we actually seeing, right? Let's share a few stories. So when I was in residency, let me start with this story. So by God's grace, yes, it's good to share. So I trained at the biggest women's hospital by the grace of God in the Washington, D.C. area, okay? So when I was in residency, I remember one night, actually I was on the day shift and then I was going home and then, was I on day? Yeah, I was on days. So I admitted this patient, okay? And she had a very unique story because she was coming in and she was in her 50s, coming in actually to deliver. No IVF, nothing, okay? She was just in her 50s coming in to deliver a baby, all right? Now, I admitted her, met her husband, very lovely family, no issues, admitted them, no problem, okay? She was actually a private patient and coming in to deliver because that was the hospital that her doctor used to deliver at, although the hospital was primarily a teaching hospital. But thank God that she came there. So again, for context, this is the largest hospital in the DC area, okay? So she comes and she's admitted. I come back the next morning and the entire ward is like in chaos. I'm like, okay, what's going on? I mean, obstetrics, there's usually something going on, but I knew that something had gone on. So I finally went to morning report to now listen to all the reports on all the patients, right? Okay, guys, let me tell you what happened. This woman was progressing through labor. At some point, she stopped progressing through labor. Okay, it's called arrest of dilation, wherein a woman doesn't dilate, and we'll do a discussion on that one day, where a woman doesn't dilate or change after over 4 hours in labor. So she now gets taken to the operating room for a C-section. Okay, in the course of the C-section, she starts to bleed. And she's bleeding, and the doctor is like, okay, this is not stopping. Mind you, this is an obstetrician, so she's trained surgically to be able to do it, okay? Now, it's always good in medicine, and for all my mentees listening, for anyone in medicine, students, residents, attending, what have you, phone a friend. When you don't know what to do, phone a friend. That is one of the most important things I learned training in an academic institution. It's very dangerous to ever think that you know it all. In fact, one of my mentors told me once when I was in medical school, and I felt like I didn't know everything. In fact, that was my exact complaint to him. I feel like I don't know everything. He turned and looked at me and said to me, the day that you feel like you know everything is the exact day that you should quit medicine. That is the exact day that you should quit. Because what happens when that is the case is that you start to get arrogant and you feel like you know it all. But this is science, and there's no such thing as a perfect science. So every single day, the recommendations are changing. Every single day, I have to read research. Every single day, I have to keep up with the times. Every single day. And that is the marker of a good researcher and a good scientist and a good doctor. So I learned that lesson. So anyway, going back to the story, the obstetrician, the private doctor now calls the academic doctor. Now, the doctor who was on, I'm not going to say her name, but I've worked with her personally, and she is creme de la creme. She's an amazing doctor, amazing teacher. And I thank God that she was on that night. This woman comes in, okay? Now she's one of our faculty. She comes in and she's like, okay, like she's there to help. Because when it's time, the focus is always the patient, okay? We literally just adopt a team mindset in moments like that. So she comes in and she's like, they update her on what's going on. This woman is bleeding out profusely, okay? Profusely. Meaning they cannot stop the bleed. They could not even identify where the bleed was coming from. And I'm saying that this is the largest hospital in DC to give you context to understand that the cases that we took care of, the cases we saw were the worst of the worst of the worst of the worst, okay? Like when people didn't know what to do, they brought them to our teaching hospital. This woman was bleeding out so much. Now, when someone is bleeding out, you have to replenish the blood. Because what happens is if you don't do that, then the person can potentially bleed out and that's it. You've now lost them completely. So as she's bleeding out and they're trying to stop the bleed, they're also giving her blood transfusions, okay? All right. Finally, they realize like, okay, this is really not good. Now, when you have to escalate to the surgical team, I don't mean now obstetricians and gyn. When the obstetricians and gynecologists who are surgically trained have to call in general surgery, then it's a problem. Then you know you're really, really in trouble. So they call general surgery. General surgery comes. And they're looking everywhere. They're looking to try and stop this bleed. They actually, there's a procedure, it's called uterine artery embolization. They did that. This thing would not stop. It would not stop. It would not stop. The general surgeons now call. Are you seeing what's happening here? It started off with the private obstetrician who called in the academic obstetrician. The academic obstetrician came in the room, called in the general surgeon. And then the general surgeon, now it's like, we've tried an embolization. This thing is not working. They called in vascular surgery. There were 4 different, I don't even know how many people were in the operating room, because in one regular delivery, with the way I trained in an academic setting, there would be easily 15 to 20 people in any delivery. By the time you count students, resident, like everybody, because that's how we learn. Medicine is see one, do one, teach one. That's it. See one, do one, teach one. That is how you learn in medicine. If you don't see it, you don't do it. You cannot know it and teach it. That's just how it works. So I cannot even imagine how many people were in this room, okay? By the morning, by the time the vascular surgeon came in, by the grace of God, they were able to do a novel technique by God's grace. And some way, somehow, they stopped this bleed. For context, I keep saying this is the largest hospital in Washington, D.C., because I want to put things into perspective for you. This woman, this case, this situation, I want you to know how serious this thing is. All of the blood in the blood bank was used up. All of it. I mean, all of it. All of the blood in the largest blood bank in Washington, D.C. was used up in this one patient. Not only that, she received, I believe it was over 10, I believe specifically about 13, units of fresh frozen plasma. She received platelets. She received, basically, this is what happened. She literally bled out. That's the honest truth. She bled out and they completely, literally give this woman back all the pints of blood that she had lost, plus fresh frozen plasma, which has the white blood cell components, plus platelets. This woman had bled everything out. And I say this with all humility, and I say this to the glory of God. But if she was not at that specific hospital, which had that specific capability, I don't know that she would have made it. I'm not God, but I don't know that she would have made it. Because by the morning, when I was coming in, that was all we were talking about. That was all anyone could talk about. I'm talking Christian, atheists, Buddhists, whatever you want, whatever religious belief people were. Everybody was stunned that this woman lived through that situation. Everybody. Nobody could talk about anything else. How did she live was the question. I mean, she used up, do you know what that means? To use up all of the blood at the largest blood bank in Washington, D.C.? Oh. And then she lived. Not only did she live, but she then got transferred for close monitoring to the ICU. Okay? Do you know that by the time I was coming on for my shift at 8 a.m., and the Lord had told me to pray for this woman before I left. I prayed for her and I left, and that was it. The obstetrician, my academic attending, the academic obstetrician who had come in, who I just love this woman so much. She had come in. She was so stunned by this situation that she told me, she said, Larissa, I have to go to the ICU and I have to see with my own 2 eyes that this woman is alive and that this woman has opened her eyes. She could not believe it. She genuinely could not believe it. But to the glory of God, the woman lived. And guess what? She was a believer. The patient was a believer. Look what God did. She actually was a believer. And then I saw her husband in the elevator. Actually, now I'm thinking of this story more. I'm like, wait, okay. Because her husband, he was in the elevator. He had gone down to get coffee. And I remembered him because I had just admitted them the night before. When I prayed for her, I didn't pray with her. I prayed for her in my heart and I left. The Lord did not tell me to hold hands and pray with her or anything like that. So anyway, her husband, when I was just like, oh, good morning, how are you? It didn't click when I was coming in for my shift that this was the same husband. This was her husband. And he was like, well, my baby is in the nursery and my wife is in the ICU. But other than that, I'm okay. I didn't know that this was the situation I was walking into. And I was like, oh, I mean, I hope they're all okay. I hope everything is fine. But we thank God for their life. I just thought it was a bit of, you tell someone good morning. You're like, yeah, good morning. You keep it moving. But When I now understood the story, I was like, so this man was giving me such a calm response when this is the situation that had just happened. I needed him to tell me everything in that elevator ride. Everything. So anyway, look what God did. These are the kinds of stories and situations that can happen. And I share this story to say that was years ago when I was training. But clearly, it impacted me so much that I still remember it. I still remember. I don't think I'll ever forget that case. I don't think I will ever forget that case. That's how medicine is. There are some landmark cases that just stay with you for the rest of your career. And I know for me, this for sure is one of them. And so it leads to the topic we're discussing today, right? Postpartum hemorrhage, this excessive bleeding. Again, some degree of bleeding we expect to see, but when it becomes excessive, that's when it's a problem. And so there are some risk factors. If you have questions, please feel free to send them in the chat. If you have comments on the story, feel free to send them in. But I just want to share 3 risk factors. Many things can cause it. And in some cases, we actually may not even be able to know. But anyway, I'll end with something which will encourage us all. But there are 3 risk factors I want to talk about. The first one is what we call uterine atony. This is a condition in which the uterus, after the baby is delivered, doesn't contract. And so it's what we call loose. Now, the uterus is a muscle. The way it works is it has to contract down. It expands, right, as the baby is growing. And then after the baby comes out, it has to contract. As it contracts, that helps it helps the baby come out. The same contractions help with the placenta coming out. Now, if we don't have sufficient contraction of the uterus that continues after, that can actually lead to hemorrhage. It can lead to hemorrhage because there's a bit too much bleeding happening. There can also be obstetric complications that happen. So this actually ties into it. So again, the uterus contracting down helps even the delivery of the placenta. If for some reason the uterus is not contracting well, then what can happen is that bits of the placenta will remain. So every time we deliver a baby, we then have to look at the entire placenta to make sure that it's complete. Obstetrics is tricky because it's not a perfect science. In fact, to be honest, there's no perfect science, but it's a bit tricky to be perfect, so to speak, in obstetrics. And I truly believe that this is one of the fields of medicine, not that the whole thing doesn't show it, but it's really a daily reminder of the grace and the mercy of God, to be completely honest with you. And so we look to make sure the placenta is complete. If we notice that there's any missing, then we go back and we do what we call a massage to try and see if we can get whatever is left there. Because if any bit of the placenta remains, then it becomes a problem. Now, I think that's a revelation. That's actually important because it talks about times and seasons. Sometimes you need something. It's literally for your nourishment. It is absolutely necessary. But sometimes as soon as the season is done, that door absolutely has to close. Otherwise, it now becomes detrimental. And that is exactly what happens to the placenta as soon as the baby is out. It must come out. The placenta must come out completely. And then the last thing I'll say is maybe for some reason, the woman doesn't have prenatal care. She was late to care. Maybe there were some complications. It wasn't really known. That's another thing that can lead to this situation. So those are some of the risk factors that can create such a state or condition. Now, how can we prevent this? I want to be careful with how I answer this because it's social media. So every clinical case is different, right? But know that there are medications which can be used to help the placenta contract down if it's not contracting. Active monitoring is big. That first 24-hour period, I know it's exciting. The baby is here, everybody is happy, we're relaxing. But, for the person who delivers the mom, your eyes are on the mother. Your eyes are on her because you know that within that 24-hour, period, a lot can happen. A lot of great things, but also a lot of concerning things. So that active monitoring is very important. If you notice that you're passing large clots, which are larger than the size of a golf ball, that's usually the metric we use. That is definitely a reason to call your doctor or let them know that you're passing clots, okay? Larger than a golf ball. If you pass some clots, it's to be expected because, again, your body is shedding all that it needed during that time for the baby to grow. But again, once the baby is out, it's like time to clean house immediately. The season changes just like that. Now, there's one last thing I want to mention in regards to prevention. One of the things that I think is important to know is if we can prevent induction of labor, which is not necessary. Sometimes you need to induce labor. Right? If something concerning or life-threatening is happening to the mother or to the baby, sometimes it is necessary. And again, it's a case-by-case basis to induce labor. However, there are times when inductions maybe are not necessary. There are also times when it may not be necessary to do what we call augmentation of labor. This is when medically we give a woman medication to start labor or to push it along. Why? The types of medications which are given, they're given to help, right? But that helping, how does it help? It helps to cause more contraction, and that can actually lead to uterine atony because the uterus is fatigued. It's like any muscle. Anyone who works out regularly, like at some point, your muscles reach a point where they're fatigued. And you know you're at the end of your workout when that happens. And it's kind of the same thing that happens with the uterus because it's a muscle. So if we can prevent unnecessary inductions, if we can allow women to truly progress, as long as they're low risk, there's no issue, then I think that would be one of the most practical things we can do. And one of the things that you should know. This is why it's so important to labor as much as possible at home. And this is why Rofi is important, because you learn things like this when you join the pregnancy protocol at Rofi. If you know anyone who's pregnant, please send them our way. Because whether you've been pregnant 10,000 times, the truth of the matter is no one comes out of the womb knowing how to be pregnant. Nobody. Literally nobody. We must learn how to write. We must learn how to speak, how to eat. But why do we think that we should just automatically know how to do this thing called pregnancy or even postpartum? We need to learn. Knowledge is power. And without knowledge, we become literally candidates for destruction by the enemy. So those are some of the things I wanted to talk about. In recent times, you may have heard of a nurse midwife who actually did a lot of work advocating for women, taking care of women throughout her career. Her name was Dr. Janelle Green Smith. If you heard of her, may her soul rest in peace. But this is actually what happened to her. She ended up, unfortunately, dying because of postpartum hemorrhage. And I think it was so sad. You'd spend time taking care of so many people, and then at your point of need, you end up developing such a complication. There's so many reasons people have hypothesized. What happened? Why did this happen? And, she was a Black woman. Is it because of, the fact that the stats are so bad with Black women and all the things? And I'll be very honest, I've learned in my medical career, if I'm not in the room and I don't know the facts of the case, I'm very careful with how I speak about that. But I can say that, one, I pray her soul rests in peace. Two, I think it's quite sad how she died. Three, I don't want to speak carelessly about it because not only was this a woman's life, right? Literally someone's life, someone's mother, someone's wife. I don't want to speak carelessly about it, contribute to a narrative that I don't even know enough about. But the point of the matter is that this thing called postpartum hemorrhage is not a joke. It's one of the leading causes of maternal death. And it's unfortunate that it's frankly no respecter of person. And as I was reflecting today, by God's grace, one of my patients actually gave birth today. And I was just so thrilled. But this topic is what I believe the Lord told me to talk about today. And it just really made me think of the mercy of God. Every single time a woman gets pregnant, every time a woman has a baby, this is God's mercy on display. Because who is to say and all the things? Who is to say what could happen? So I just want to end with a scripture. It's Lamentations chapter 3 verse 22. It says, "It is because of the Lord's loving kindness or mercy that we are not consumed, or that we are saved. They are new every morning. Great and beyond measure is your faithfulness." And so that's my encouragement to you today. To know that God is faithful. Because he's faithful, you don't need to be afraid. I encounter so many women who are afraid of getting pregnant, or what will happen to them during their pregnancy, or what will happen to them when it's time to deliver their babies or postpartum. My patient who delivered today, I'll let her tell her story in due time when she comes. But when we first started working together, she was so concerned. And God really did it for her. Why? Because she had faith. Her faith grew. Sometimes your faith has to grow. I wrote a book, it's called Cherishing Pregnancy, and every week there's literally a scripture to focus on. It focuses on what's happening to your baby, what's happening to your body, and it gives you an anchor word for the week to literally meditate on and chew on and to really pray. And she did that. She had her anchor scriptures and she just kept on holding on to God's word. And one thing I've learned is that God is faithful. God is really faithful, and God really loves you. So if you're currently pregnant or you're looking to get pregnant, even his faithfulness, it is his faithfulness that will visit you and that will help you to even conceive. Because no one knows the time of conception, by the way. No doctor can tell you. We don't know. We can tell you when you ovulate or this or that, but the exact moment, that's only God. It's only God with conception. So, I pray that encourages you. I pray that you learned something new. Please share this with at least 10 people. And if you're catching the replay, again, my name is Dr. Larissa Assam. It was a pleasure getting to speak with you today. If you are not already following my page, please do so. Make sure you subscribe to my YouTube channel, subscribe to my podcast, share it everywhere, please. And let's make sure that we make the world a healthier and a safer place for women. All right? God bless you. Have a good evening. Bye.